So I'd like to do a little more techniques in a seated position before we move on. I want to mention that all of our rolling patterns that we've learned, all 3 types of rolling, can be done for this levator trap area at the top of the shoulder. Again, you just want to stabilize the head so you're not moving it all over the place. And it's not going to be super heavy pressure. I'm just... That 5th metacarpal head again. Yep, pinky knuckle.
So it's that one, right? That you taught us.
This is the traditional one. You can use that. I tend to do it across body, so I'm not using my left on her left. I'm using my right on her left. But if it's more comfortable the other way, that's fine. You can also use the modern flipping snappy kind of rolling. Just don't hit them in the back of the head with your wrist. So you may have to be just a little lower on the shoulder for that one. This is actually one of the few areas this one I think feels really, really good. It works really well in a massage chair as well to work on these because you don't have to stabilize the head. They're in the face cradle. Right. Shanghai rolling is also possible. I tend to use a little more of the distal forearm than coming up here if I'm going to do that. If you prefer to work down the trap, you can certainly do that as well. Just don't smack people in the face. So if you're hitting them in the face, you may need to shorten your movement or reposition your angle. So all 3 rolling perfectly acceptable on this area of the body.
The going up feels better.
Does it?
Okay. Yeah, because I'm stretching and grabbing.
Round rubbing, kneading, and jostling are all appropriate, and I kind of blend them all together for this same levator insertion area. Come to the far side of the table using that thenar eminence. Do a little bit of round rubbing or kneading, depending on your pressure. Once you kind of loosened up or warmed up the area, you can just apply a little bit of downward pressure and waggle that side back and forth. Your non-dominant hand is much tougher. Coming over and doing it on the dominant side, a lot easier. So I'm going to turn you around on the stool since we have a nice rolly stool. And you can see here, kneading or round rubbing, again, depending on your pressure. Pushing down lighter to move the skin or deeper to move the muscle technically changes the name. And then purchasing on that insertion and jostling the muscle back and forth. This round rubbing I do all the way down the back, not so much in an upright position, but if they're in a massage chair, I'll work all of paraspinals with that round rubbing and that thenar eminence. It's a real easy one to do pretty much all the way down. Working this upper trap area, pressing or penetrating, static pressure techniques are fair game. I'm going to turn you back around here, love. Depending on the height of the stool and what you're comfortable with, I'll often use that 5th metacarpal head. Come in and find that tight spot. If they're waggling around, you can stabilize the head, pressing down. Whichever side is more comfortable, honestly. If it's easier for you to come in this way to do it, that's fair game. The preferred tool for me is my elbow, though. If I'm in this position, I can drop in the elbow. And if you want to, you can drop them both in there. I just try to gently cradle their head between my forearms so they don't have to try to hold it up.
That is awesome.
Scream before you kick, love.
It comes my Audrey Hepburn neck.
The nice thing about this is it's super easy on you. You can hold pressure forever. Chair massage, often I'll do just one side at a time because they're forward leaning, and it'll be the opposite elbow to get in there because they're in the face cradle and I can't really get over the head as easy. But I'll just come in and use it this way, and that works well. And if you're into the jostling, the little light bulb jostle feels nice.
That's the Groucho Marx move.
Groucho Marx. The last thing I'll talk about is using the elbow to press or penetrate under the occiput. This is something that I do a lot on the table, and we'll talk about again when we're supine. But in this position, I can gently tip her head, place the tip of my elbow right up under the occiput, use my other hand, and pull her head towards me to push the elbow up under the occiput. Depending on the height of the stool, you may not have to crouch quite as much as I am. It's a little low. She's shorty. Is that too much? You can play with how bent your elbow is, how flexed or extended, to make it a smaller point. And if it's more comfortable to put the hand past your head, I usually put it down underneath and have this internally rotated position, but sometimes it's easier this way. It just depends on the neck that I'm working on. And I'm going to do her other side so she's not completely unbalanced.
See, that solid elbow feels good to lean back again. Yeah.
Yeah, you're to the right.